Hi, this is Brent Graham. In the last 9 months, the Journal of Hand Surgery has experienced an unprecedented increase in the number of submissions to our journal. This has definitely presented some challenges in our responses to authors who submit their manuscripts to us, and we see this as a distinct disadvantage for those authors. At first, we had attributed this increase to the effects of the pandemic. However, increasingly, this looks to be what we can expect to be our new normal. And as a result, we're trying to develop some new workflows to help address this increased volume of manuscripts being sent for our consideration. Although this doesn't really have much of an impact on readers, it certainly does on authors. And for any authors who are listening to this, I just want to assure you that we are working as hard as possible to try to meet your needs. This month in the journal, our lead article was contributed by Dr. Erica Sears and her colleagues at the University of Michigan. This is the latest in a series of investigations that Dr. Sears has carried out looking at the ways in which patients with carpal tunnel syndrome are evaluated and treated. She's made some interesting observations, especially with respect to the ongoing challenges of understanding the role of electrodiagnostic testing in the evaluation of these patients. I think you'll find some of the results interesting, to say the least. Dr. Sears was also my guest for this month's podcast, and I'd encourage you to take a listen to that as well, because she does expand on the meaning of some of these findings. Our Twitter-based journal club will take place on February 9th at 9 p.m. Eastern Standard Time, and this is one of the papers that we'll be discussing, so I hope that you'll find time to join us for this activity.